So restarting the power on the camera, and we'll go back to where we left off, which is back at you. So the timing might be a little bit funny. All right, so we'll start with the abbreviation. So this is
less than.
Yeah, there's a lot. Yeah, there's a lot that you will know just from day-to-day living. Let's pretend I didn't already do this.
At. Abdominal.
Abdominal. Yeah. Abdomen.
I can't remember.
Activities of daily living.
Yes, right. Accident and emergency. Or AM.
The morning.
Yep. Above knee amputation.
Well done. I am impressed. Something we do every day. Bowel action. Basal cell carcinoma. So that's a skin. Basal cell. BCC is a benign, usually benign skin cancer. It looks like usually a rash, but if you leave it for a long time, it can start getting deeper and can sort of spread. So you still need to get it fixed.
Yeah.
So BD twice a day.
Okay, that's right. Yep. And
BGL.
Glucose, blood sugar.
Yep.
Below knee amputation.
Well done. Do you remember this one? The opposite to this one.
Bowel not open.
Yes.
Blood pressure.
Yep. Very good.
Cancer.
Yep.
Cardio.
Very good. Close. Congestive cardiac failure.
Yep.
So a lot of people get that. When people if they've got a bit of a cardiac history, a heart condition, congestive cardiac failure, what happens is the heart can't pump strong enough to get fluids around the body, so it actually goes into other spots where it's not meant to. So that's when people start getting edema. Do you know what edema is? Fluid into spaces that aren't meant to be there. They also get fluid in the lungs and stuff.
Okay.
And they might have to get tapped off. So that's what happens with congestive cardiac failure. So CCU, coronary care unit, central
nervous system.
Yeah. This is it. This is the other term, the medical term for a stroke.
Vascular.
Yeah. So C is
cerebral vascular accident.
Well done. Chest X-ray.
Yep. No date of birth. New arrival. Deep vein thrombosis. Daily. Echocardiograph.
Yep.
Yep.
ED. Emergency.
Emergency department.
Emergency department or emergency. So
no stroke.
Yeah. Fluid balance chart.
Oh, okay.
So the reason it's good for you to know that because these are part of all the different notes that are part of the medical file. So to be aware of their name and their abbreviations. And so if people write you quickly notes, can you order these? Do you know what I mean? So then you'll go, I know what that is. And that's full weight bearing. I almost had So that means people can get up. If they're partial weight bearing, if they're full weight bearing, they can get up on their own, they don't need any aids. And if they're partial weight bearing, it might mean they need a frame or a stick so they don't wobble and topple over and stuff. So that's
general admission?
General GA.
General
anesthesia.
Yeah. Gastrointestinal
tract.
Yeah. I don't know GT.
No, it's for diabetics. They have a glucose tolerance.
Okay, yeah.
So you might even have that sometime. They say fasting blood and check your glucose.
Is that the one you do when you're pregnant?
Yes, they do, and you drink that stuff. Hemoglobin, HB, that's like a part of blood results, has not passed urine.
Oh, okay.
ICU.
Intensive care unit.
Indwelling catheter. That goes for your wee, catches your wee.
Yep.
After a seizure you have that because you can't move and you can't have control of your bladder. IV therapy. Intravenous.
Intravenous
therapy. I'm using abbreviations to explain abbreviations. Intravenous. And this is an IDEM, is an insulin-dependent diabetes mellitus. So that's so it's a diabetic. There's non-insulin, so that would be a NIDM, NIDDM. So they don't need insulin; they can be diet controlled. So an IDEM is someone that needs to have insulin shots to control their diabetes. IM's intramuscular. No, that doesn't. It's not left. That's LFT. It's a liver function test. It's a type of blood. So you have a full blood count maybe, and then an LFT. It's two different types of blood tests. LL means lower lobe. So that pertains usually to the lungs.
Okay.
So, or it actually can also be lower limb.
Okay,
Talk about the legs. So it depends the context. Sometimes abbreviations do change.
Yep.
Depending on the contents. This is left lower quadrant, and this is talking about the abdomen. The abdomen is divided into 4. 1, 2, 3, 4. So you have the upper quadrant and the lower, and then there's the left and the right.
Yep.
The right and the left, because they're opposite.
Okay.
Yeah.
Okay.
Left upper quadrant. Yep. LMO is local medical officer or GP. LOC is loss of consciousness.
Okay.
MANE means morning.
Oh, okay.
Yep. Meds is medications. MO is medical officer, another term. So it can be either GP or they could be talking about in-house, one of the medical officers, within. Whereas an LMO is always the local to where they live, their GP. But this can mean either. Motor vehicle accident.
Okay, yep.
This is medical resonant. I can't pronounce it. I have to. Magnetic resonance imaging.
Okay.
So that's the MRI. That's one of the newer, I guess, type of X-ray. Okay. And they're not in every hospital. I think they're getting more and more common. But it's like back in the day, CT scanner was a big thing, and only a couple of hospitals in Melbourne when I lived down there had them. But now everyone has a CT scanner, so this has taken its place, the MRI scan. This is no abnormalities detected.
Okay.
So that's the result. If someone goes and has, say, to the GP, and you're the receptionist, and they go have blood tests and stuff, the results come back, the doctors check it, it comes back to the front desk. A lot of times they'll actually write NAD and sign it. So that usually depends on the policies and procedures of where you're working, but that usually means that you can actually say everything's okay with those tests that you have.
Okay, yeah.
So, Okay, NCP, I've just got a blank. Nursing care plan. I don't know why I had a blank for that one. NEB is nebulizer, for asthmatic.
Yep.
Not pharesa, NFR.
Yes.
Nasal gastric tube. Some people have little babies, or people have a tube down that goes from their nose, gastric, to their stomach. Next of kin is NOC, NOK. Observation, on examination, operating theatre, O2 saturations, oxygen levels, PCA, patient-controlled analgesia, pulmonary embolus, not PE, not playing sports, physiotherapy.
Yep.
So pulmonary embolus, if someone says depends on where you're working. I know that you're admin, but sometimes when something of urgency happens, you have to get involved with contacting maybe other people to help. A PE is an emergency. It's a triple O emergency.
Okay.
So it's good to know, to have an understanding of all these things. And I'll just check the taping. Just because sometimes you do get involved that little bit, making that phone call. So if you're in a GP, you'd be ringing an ambulance.
Yes.
Yeah. Physiotherapy, and that's physio. It can either pertain to the person or to the action of having physio. So it depends on the way you use it. but that's also physiotherapy. So it can be about, this one more is the action of physiotherapy, of having it, and this one's usually usually it's about the person over there that's trained as a physiotherapist. Yeah.
Okay. Yeah.
PM afternoon.
Yep.
Post-op, post-operative. Yep. Plaster of Paris, not someone's grandfather. Patient. Partial weight bear. So the reason that would be important is the other thing is if you're given a note as well to say, oh, you know, Mr. Smith, say if you're working in a hospital as a ward class, Mr. Smith, physio or x-rays at 2 o'clock, partial weight bearing. Or they write it down, PWB, and you're reading it. So that means he can't walk himself down.
He needs help. Yeah.
He needs help. He probably needs to get either a trolley, you know, you have to also then go and ask more questions.
Yeah.
What can you do? Do we need to get a trolley for him? Do we need to just get a wheelchair? Yeah. So you just need to, it just puts an alert out there for you. Red blood cells, rehabilitation. This is rest in bed.
Okay.
So sometimes in hospitals or something, on the back they'll actually have that written, so you know that Mrs. Jones can't come to the phone. You don't try and encourage her, especially if she's got dementia or something. Come on, Mrs. Jones, come and get your phone call or something. You know what I mean?
Yeah.
It just gives you the awareness as well. When you see an R or an L in the brackets, that means right or left.
Oh, okay. Yes.
So right, lower, low.
Okay.
Or rote, lower limb. Yeah, one or the other. So right, lower quadrant.
Yep.
Resident medical officer. So that pertains to the hierarchy in a hospital. So you have interns and then newbies. You've got the specialists, and these guys are training to become. RMO, they're training to become a specialist. So they're a doctor, they're fully fledged doctor, but now they're going, okay, I want to be a radiographer. Oh my goodness. A radiologist. So I'm going to study, and they're in the process of studying that. So then they sort of go up in the ranks, and they know more about it than say an intern or second year resident, but they're not qualified yet.
Yeah. Okay.
Range of movement, respiration rate, return to ward. Now this one is another one. This actually means prescription.
Oh.
or treatment. So they classify when you're treating someone has prescribed a treatment for that person. So whether it be a script in the hand, a piece of paper, or whether it be a course of treatment, because a script is a course of treatment, but also say if you've had a knee replacement, and now the treatment, which is this, be written down like that, is to get out of bed in the morning. So that's also like a prescription.
Yeah.
Does that make sense?
Yeah.
Stat.
Statistics?
Now.
Now.
Immediately.
Okay, right.
Shortness of breath. It doesn't mean son of a gun that some people say in there. TDS is 3 times a daily.
Okay.
A TURP is a procedure for men. If they've had a prostate problem and they've fixed it up, it's called a transurethral resection of the prostate.
Okay.
Which is a TURP. Which is,
right.
Therapy. UTI.
Upper respiratory tract infection.
UTI.
Urinary tract infection.
Not to be confused with one or the other, because they're other ends of the people. Now, UR is a unit record. So you find that in most or all hospitals and most medical clinics, not only will they have the patient's name, but they'll also have a unique number, and that's called a UR, a UR number. And that's for that one person, not to be confused. That's usually, if you had, 5 John Smiths, you'll know which one, besides date of birth, you'll know which, where to file stuff. White blood cell. Okay. withdrawals. I've had a blank again. Yeah.
Yes, years. Yeah.
Yeah. Okay. So I'm just going to run over this very quickly and about some medical staff may still use the abbreviations in the next graph, but apparently I found out in 2006 they were recommended not to use them because of misinterpretation or confusion. So for 1 month, you actually are meant to write for 1 month, not 1/12.
Yep.
And 6 weeks, 6:52. I've been using these as a nurse in midwife since I was a student, so it doesn't confuse me. I guess it's the new people that get confused. But if you're ever confused about anything, and it's the same for whether you're a medical secretary or you're a nurse or a student, is you have to ask.
Yeah, that's right.
And confer with people, and it's so important when you are working in medical, in the medical system. It's just so important. Yeah, to just not get it wrong, just to ask and seek advice, and then you don't have to guess. How are you going?
All right. Yes.
Have I confused? I know we're rushing a little bit, aren't we?
No.
So, name the 3 components that make up a medical term.
Prefix.
Yep.
Root.
Yep.
And suffix. Yep.
If you're working in a hospital as a ward clerk and the registered nurse asks you to go get some blood tubes, which department would you go to? The radiology department, haematology, cardiology, or gastroenterology?
Haematology.
Yeah. If you saw your GP and she informed you that you had dermatitis, what condition would you have?
Inflammation of the skin.
Yeah, very good. An echocardiogram would be an X-ray of intestine, bladder, heart. Yeah. You're beating me. Your son is a medical practitioner and would like to specialise in the field of X-rays.